People ask how to differentiate between an expert and a beginner physio. I think in addition to knowledge and experience, the most important feature I feel is how sensitive their hands are. Okay? A physio with highly sensitive hands can be very great with diagnosing problems. So hands can be a great diagnostic tools. So if a physio can have sensitive hands, they tend to be very good at diagnose and treat problems. So I want to show you how we train our physio and chiro develop sensitivity with their hands. If our patient is very overweight, okay, how can we palpate a patient with a very large layer of soft tissues? Okay, so for example, this is one technique that we practice. We wanted to get towels, and we put the towel on the patient, okay, on the subject, and say for example, we wanted to palpate the vertebral muscle, okay, so we should be able to still palpate the vertebral muscle, even patients, even with additional layer of towels, okay, so it's probably easier to feel on your right side. So the trick is you want to go light hand. Your hands has to be light. Okay, the one common problem is if people can't feel it, they want to press harder. You actually have to go more gentle, and you can feel that tight spot. Yep, tender there. Okay, now to make it harder, you increase the layer. Okay, you should still be able to feel the tightness. Okay, and ask your patient, can he feel the tenderness? Can you feel the tenderness there? Yes. Yep. Okay. Now, to make it even harder, we fold it again. So now we got how many layers? Like 8 layers on top. Okay, and I think you should still be able to feel the tension. Okay, the key is you want it to go down to the R1. Okay, to the first onset of resistance, that's the depth, and then you want to move your finger, still maintaining the depth, the same depth. Okay, and I can feel tension here. How's that feel? Still feel that? Yeah,
it feels tender.
Yeah, it's tender. So whether the patient is thin or whether the patient is obese really doesn't matter. Okay, as long as you can go down, you can maintain the pressure at R1 and then move your finger while maintaining the R1. Okay. So you can practice that. Okay, we have patients who were really obese, and you would think it's not possible to palpate them. In fact, it's quite the opposite. Just a very gentle touch, you can, they feel so much pain with just gentle pressure. Okay. All right. So that's how we enhance our palpation skill. Good.